Okay. I'm here today with Leah Matudi, who's a young lady who's been having jaw symptoms and discomfort for some time now. So I've asked her to sort of tell me about her condition and what it's been like and how long it's been bothering her.
So my jaw has been bothering me for about 13 years now. When I was younger, I actually went to physiotherapy to get deep tissue massages because it was so painful. And essentially, my whole face, my jaw and my temples constantly feel tender to the point where I do get headaches. But probably the most irritating thing is the jaw tiredness and discomfort. So when I open my mouth, a lot of times there's a pretty significant cracking sound on the left, to the point that people around me can hear it. It's not just something that I can hear, everyone can hear it around me, so it's pretty loud. And I sometimes feel like it's stuck, so I'll be working and in meetings, and I feel like I have to like crack my jaw and unblock it so that I can be comfortable again. But it definitely leads to tiredness. If I'm eating steak, for example, or chewing gum, my jaw often feels pretty tired and I need to take a break.
So has that tiredness become most meals or only certain foods, or has it gotten worse over time?
It's definitely gotten worse over time. I would say that the discomfort and like that need to release it happens 10 to 15 times a day. So it's very much just throughout the day. Certain foods are worse than others, but it's still pretty bad no matter what.
So you have a tension there that's present and most of the time, which will worsen when you actually use your jaw.
Yeah, exactly.
And the unlocking of it, does it relieve the symptoms or does it make it more tolerable? What does like releasing it mean to you?
It feels like it relieves it temporarily, where my jaw feels like it can open more loosely. It opens a little bit easier. It doesn't feel as tired, or that I'm unable to open my mouth fully. But that relief only lasts for a brief amount of time.
And then it tightens up again.
Yeah.
And if you talk or chew or eat, it speeds up the tightening.
Yeah, for sure.
And how old are you now?
25.
And you had braces?
Never.
Never had braces. So this just came on by itself when you were a teenager.
Yeah, I've never had any major orthodontic work done.
And what treatments have you tried for it?
So, like I said, when I was younger, I was doing the deep tissue massages by a professional, and my dentist pretty much have just recommended massaging it, and that's pretty much it. I've never really been offered a solution or been told, that there is some kind of treatment. So all I've ever really done is just massage the muscles in my cheeks and my temples to help relieve some of that pain and discomfort.
So you never wore an appliance or a night guard or tried to do that?
No.
Even a sports one?
No.
No. So and no one recommended one to you?
No.
It's interesting. And you said you grew up in Asia.
Yeah.
What time did you come to the United States? How old were you?
I came at the age of 18 when I went for college.
So while you were growing up in Asia, no one ever offered you a night guard, a mouth guard, an appliance?
No, so I went to an orthodontist to talk about the options, and they mentioned that there is a relatively major surgery that we spoke about a little bit, but that my case wasn't severe enough to warrant it, but nothing really was recommended after that point.
So this, having your bite refined tail, would be your first real treatment for it?
Yes.
Okay. And is there anything else you can tell me about it that I didn't ask you?
I think that's about it. One thing that's interesting is I definitely do feel like my muscles are working hard. I'm like a very active person, so I can feel when my muscles are tensing up, and I definitely actively feel it in especially the lower portion of my face. So I can feel that it's activating quite a bit throughout the day.
And that's as you go about trying to work or...
Yeah, just anything, even if I'm not eating, just normal working, I can feel it activating.
Do you know if you grind your teeth or clench your teeth?
I think as I've gotten older a little bit, and I don't know if it's just a reaction to what I'm feeling, but I don't believe I grind them at night, but definitely sometimes when I'm working or if I'm stressed, I feel like I'm clenching, but not grinding.
So if you wake up in the morning, you don't notice, I shouldn't ask it this way, if you wake up in the morning, do you have tightness in your jaw that's noticeable that you have to stretch your jaw out or you have to loosen it up?
Nothing that's not happening throughout the day. So it's not that it's worse in the morning, it's pretty much consistent throughout the day.
Okay, good. All right, we're going to straighten it out for you, and then we'll talk again.
Thank you.
Okay, so Leah, you've just had your bite adjusted, you had your disclusion time changed, so what feels different to you now?
I feel like it's a lot smoother when I'm moving from right to left, whereas before it felt a little bit hard to actually make that movement. And now just opening my mouth feels clean. I'm not hearing a cracking. And it just feels like my muscles are less stressed and more relaxed. And I think the one cool thing is now when my mouth is closed too, it felt like very tense before, but now it feels more relaxed back there, less activation going on, for sure.
If I understand you, if you bite down like that, you don't feel your muscles tighten up like you did?
Not at all.
No? And what would typically happen?
The whole, like the back of my teeth and these muscles here would feel clenched.
So you can bite down now and you don't get that response?
No, I feel like it's more balanced throughout my mouth, so I can actually feel my front teeth connecting a little bit, which I used to just feel the back clenching, but now it feels more balanced.
So do you feel like you have more room in your mouth?
Yes, I feel like I have less teeth all of a sudden.
Well, you have a little less tooth structure, but you got the same number of nice teeth and great gum health. So what about your face in terms of tension in it now, like after the procedure?
It feels so much better. Like I don't feel any tension at all. And you normally feel it all from like my temples down to my jaw, and I just don't feel it anymore.
And if you open and close, do you hear as much noise?
I don't hear anything.
And would you have heard noise each time you open and closed, or just every now and then? Like
every now and then, but I would definitely feel like the pulling on this side of my mouth, which I don't feel now when I'm opening it.
Anything else that you can see as different from before to after?
I feel more relaxed. Like I just feel like everything beyond even just my jaw, like my face feels more relaxed and my head feels more relaxed.
All right, well, you're on your way healing, so you had
Thank
a very
you.
good visit one. So, and thank you for allowing me to interview you.
Thank you.
All right. Okay, so you felt you had something surprising to tell me, so please go ahead and we'll put that back on tape.
Yeah, so I kind of assumed that I would feel a difference in a few weeks or a few months or something as the muscles start to relax.
Yes.
But I didn't anticipate feeling something immediately. And I can already tell there's a significant difference when I'm biting down, a lot less pressure, and it's pretty miraculous that you can feel it immediately. It's definitely not at all what I was expecting.
Yes, well, the effects usually are noticeable by the patient in the chair, and then over a series of weeks to months, they get to the, let's say, the full healing, and they start living with a lot less discomfort from day one, but it takes some time for it to all settle in, mostly because you still chew, eat, and swallow and use your teeth, and so they will still kick up a little muscle activity as you use them, but not to the same degree. So you got a very nice muscle shutdown, so that's why you're feeling initial response. All right, so you're on your way.
Sounds good. Thank you.
Thank you. Very close. Okay, I'm back with Leah. It's been a few weeks, actually I think 3 weeks, since she had her first appointment. So what has changed for you, Leah, since you had your disclusion time changed?
So I think that the biggest change is that my whole face just feels a lot more relaxed. So it used to be that when I was working or I was deep in thought and then kind of started to think about my jaw again, I could feel that it was really, really clenched, and I don't feel that anymore. So it's very much just feels like I have a more balanced bite. It doesn't feel tight or clenched at the back. And I also am having less headaches. I used to have headaches around the temple area and also just jaw pain around here, which meant that I was constantly massaging it. But I don't feel like that's really an issue anymore. The only thing that's still there is the occasional popping, which still feels less intense than it did before.
And is it as frequent as it was before the popping?
I would say it's about 70% the same, so it's improved by 30%.
So it's less frequent, and it's less noisy. You said something about grating sounds
Yeah,
before?
so it used to feel like it would be hard for it to pop, like it was grinding and then it would pop, whereas now it's just like a small release, like it's not grinding like before.
Okay, so it's less intense of a noise or sounds that you have.
Yeah, well, I guess rather than the sound being less intense, it actually used to kind of hurt when it popped. Like it would feel like it was hurting a little bit, which the sound is still there, but the pain associated with it isn't there anymore.
You said you weren't noticing it being as clenched. Do you find yourself clenching as much?
No.
So what would happen in the daytime before that you would notice you were clenching?
Yeah, I would be working or just doing, like, not focusing on whatever, just like concentrating on work, and I would just feel like I could feel that the back of my jaw muscles were really tight and clenching. And when I would massage them to try to relieve it a little bit, I actually could feel knots in my muscles. It felt knotty, and I don't feel that anymore.
So you massage less, and you find that when you do, you don't have these sort of firm spots in there?
Yeah, so it used to be really tender to the touch. So when I would touch it, it would be sore, like sore muscles, but I don't have that feeling anymore.
And your boyfriend used to massage your face to help you?
Yes.
So in the last few weeks, did he have to do that?
No.
No. And how long did it take for you to start to notice that you had less tension and tightness?
Immediately. The only thing that I had to adjust to was my new bite. But other than that, right after the treatment, I never felt the tension and tightness again in the back of my jaw.
So it's been pretty low symptoms since the first day.
Yeah.
And you got used to your bite. How long do you think that took?
Probably 3 days.
3 days?
Yeah.
Right. And since that time, you've been less aware of it, or?
Definitely less aware of it. I feel that my jaw is less tired when I'm eating chewy things like sandwiches, so it feels a little bit easier to eat. And I used to be constantly aware of my jaw, and it kind of just feels more normal now. I'm not really hyper aware of what's going on, which is a good feeling.
So you said you noticed chewing was improved. What's different about chewing since you had your bite adjusted?
It feels like my back teeth aren't doing all of the work. So it feels like it's more balanced throughout my mouth instead of just my back teeth having to chomp down and do all the work. And so after eating it, I used to feel like my jaw was a little bit tired when I tried to open it wide again, but now it feels like pretty much normal.
I mean, after you eat, you don't have an aftermath.
Yeah, I don't have one.
Did you limit your chewing to things that wouldn't tire you? Were you?
Yeah, like I think the worst ones I was telling you before were gum and steak. Used to be pretty unbearable, but it feels pretty normal now.
So you've been able to chew gum
Yes.
and didn't give you a headache,
No.
and you've been able to chew meat.
Yeah, I haven't had any problems eating anything. And really, like I said, pretty much from the first day, I felt pretty much asymptomatic except for getting used to that new bite.
Anything you would like to add?
Well, I think that what was interesting was we noticed that my front teeth were a little bit off as well, so we fixed that today.
Yes.
And now it feels completely normal, so I think that although it felt a little bit off, it was more just because of my teeth structure. I've never had braces, so my teeth weren't perfectly in line. But I think fixing that today makes it feel even more normal.
So you have some relief up front.
What was that?
You have relief up front.
Yeah.
Yes.
So I felt like there was some tension in the front, but I actually thought that was normal because I had released the back. But now that we've fixed that, it definitely feels a lot less clenched at all across the board.
Well, as I said to you, natural relaxation brings the patient forward from the first visit.
Mm-hmm.
So seeing pressure on your front teeth was not abnormal, and but it's good to relieve it, obviously.
Yeah.
And, so that's what we did. Thank you for your candor, and I'm glad the treatment helped you. And I'll monitor you as we need. But treatment is pretty much over unless your symptoms come back. Okay?
Sounds
So
good.
keep
Thank you,
that in
Dr.
mind.
Kerstein.
All right.